Good morning. My name is Maria Karen Santico. I am an MS student at University of Maryland School of Nursing. Today, we're going to discuss about an easy to remember but very powerful tool in communication to promote patient safety and improve patient outcomes. This is the SBAR communication. When patients have to come to the hospital, it is inevitable for them to be taken care of by different healthcare professionals. As healthcare professionals, it is our responsibility to ensure that we communicate accurate and up-to-date patient information to other clinicians. After some time, that information can become cluttered or confusing. Whether you are a nurse, a physician, a therapist, your ability to communicate efficiently and effectively about the patient condition can greatly affect patient safety. The objectives of our learning for today: at the conclusion of this class, the learner will state the acronym SBAR, describe the use of SBAR communication, demonstrate the use of SBAR communication. This is the overview of our lecture for today. We're going to talk about SBAR communication, what is SBAR communication, and we'll have the opportunity to practice SBAR communication. What is SBAR? SBAR is very easy and simple to remember. S is for situation, B for background, A for assessment, and R for recommendation. Let me give you a little trivia about SBAR. SBAR was first developed by the US military as a means of communication in their nuclear submarines. As you all know, the US military works in an environment that is highly stressful and time-constrained. With the use of SBAR, they were able to transfer critical information with each other and communicate effectively among each other. It was then adopted to the aviation industry. In 2002, Dr. Michael Leonard, the leader of the patient safety at Kaiser Permanente, together with his colleague Michael Bonacum and Suzanne Graham, introduced the use of SBAR as a way of investigating patient safety. In 2013, the Joint Commission endorsed SBAR as the communication standards for nurses. Why use SBAR? It is endorsed by the Joint Commission. In fact, the Joint Commission has identified the handoff report as a real-time passing of patient information from one clinician to another. With the use of SBAR, the clinician is able to provide regularity and predictability of information about the patient condition. It's easy to use tool to improve communication. Lets nurses send a complete message to the physician. As you all know, nurses and physicians have gaps in their communication. When a nurse uses an SBAR tool, it eliminates that gap in communication style. At the same time, it flattens or temporarily flattens the hierarchy among the healthcare system. Information is given in a standardized way and it has less room for human error. In 2010, the authors of the Institute of Medicine to Err is Human has identified the communication as the leading cause of medical errors in the United States. With the use of the SBAR tool, it actually decreases the time spent on non-pertinent information because the information is provided in a clear and concise manner. Who can use SBAR communication? According to AHRQ, SBAR should be used by nurses communicating to physicians. As you all know, nurses are trained to be descriptive and narrative. However, on the other hand, physicians would like to go straight to the issue, the meat of the issue. With the use of SBAR, nurses are able to organize their thoughts and able to communicate the information about the patient in a clear and concise manner. Nursing assistants communicating with nurses, physicians to other physicians, nurses to other nurses, and administrators to physicians. When SBAR communication is a must. So when do we use SBAR? It can be used when we're communicating any urgent or non-urgent patient information, conversations with physicians and other clinicians, in-person discussion and phone calls, handoff communication. We talked about that with the Joint Commission. when escalating a concern, and when calling emergency response team. Because with the use of SBAR, you are able to impart the critical information immediately to the rapid response team. How to use SBAR. Situation. You have to give a clear, succinct overview of the patient issue. So you are trying to answer the question here, what is the situation you are calling about? B, background. Briefly state the patient history. So this can include medications of the patient, diagnosis, and history. It answers the question, what got us to this point? Assessment, what is going on? Use your best judgment. If you see any changes in your assessment, any abnormalities in vital signs or diagnostic tests, that's what you're going to report under assessment. Our recommendation, what action do you propose? When you propose an action plan, you have to be specific to the physician. It can be as simple as, doctor, can you come over and assess the patient? That can be a recommendation. Impact of SBAR to nursing. Critical information is left out without SBAR. Studies have shown it enhances patient outcomes, makes nurses more effective, and increase their confidence. We have talked about this earlier, about SBAR temporarily flattening the hierarchy in the healthcare system. It creates higher patient and family satisfaction scores because any issues from the patient or the family is addressed in a timely manner. Dramatic effect on overall healthcare. It lessens readmissions, it has lesser patient death, and it has shorter length of stay. So let me give you an example. In Germany, one of the universities, Antwerp University actually, they made a study with participated by 425 nurses. These 425 nurses were surveyed by the hospital using SBAR tool. And what they found out was that there was a decrease in the in-hospital mortality. However, there was an increase in the unplanned ICU admission. So why did that happen? The explanation is these 425 nurses were more comfortable calling the physicians at the first sign of patient deterioration using the SBAR tool. And that explains the reason why there is an increased unplanned ICU admissions. Now we go to the exciting part. We get to practice our SBAR communication. Can I have a volunteer from the class?
I can do it.
Okay.
I'll try.
Okay. I'll read the scenario for you and then you can try communicating this using the SBAR tool, okay? Mrs. S has a history of severe bladder infections and an indwelling catheter. Her temperature is now 101 degrees and her urine is foul-smelling and cloudy. In the past, a high temperature has signaled infection. Her catheter was changed 2 weeks ago. How can you communicate this to the physician? You are a bedside nurse using the SBAR tool.
Okay, so to apply SBAR to this scenario, S would be my situation. Patient is having a temperature of 101 degrees, which is very high, and her urine is foul-smelling and cloudy. B would be the background. Patient has a history of severe bladder infection, and also she has the presence of an indwelling Foley catheter. Assessment. So what do I see in this? It looks like the patient is having a severe infection again, having the temperature of 101 and a foul-smelling cloudy urine.
Yes.
So my recommendation is that because I am a little bit confident that this patient is having another infection, so my recommendation to the doctor would be, I can recommend a change in Foley catheter and have a bladder works tool to check WBC for the presence of infection. So with this, I can tell the doctor straightly that this patient is having another bladder infection.
Okay, that's very good. So how did you find that?
Oh, actually, it is very eye-opening for the use of SBAR because it eradicates this complexity of whatever I say to the doctor. It gives me the idea of just giving the straight to the point, the right deal problem to the doctor in order for the doctor to see clearly what is really going on. It prevents me from, going around the bush and,
Yes.
presenting a lot of histories which is not even necessary to the problem. So the doctor can clearly see, the real picture.
Exactly the point. Yeah, very good. Yes. So that ends my presentation. I would like to ask the class if you have any questions for me before I close this. No questions?
You did a good job.
Okay, thank you. I hope you get to find the benefit of using SBAR in your
Yes,
daily
good job.
practice. And I'm sure it's going to improve patient outcomes and promote patient safety.
Yes.
Once again, thank you.
Thank you.